Yeah, you heard my educational history there. I'm a UC Davis lifer, so I like to think about it. So it's fun to be here, especially because I was an undergrad here in engineering, right? You know, engineering building's right next door. It's fun to be back in this capacity. So yes, today we're going to talk about hormones and stress, primarily focusing on the connection between stress and cortisol, and talking about some of the associations with mental health and some of the physical health connections. I wanted to start with this quote from Hippocrates, that the natural healing force within each of us is the greatest force in getting well. And functional medicine is really all about harnessing that force, getting out of its way when we're blocking it, and providing what it needs to work. And I love that he knew this thousands of years ago, 2,000 years ago. In addition to the stress response, and which is the HPA axis, which I'll explain, we're going to talk about how it gets dysregulated. I'm going to take a little time to talk about adverse childhood experiences, and then a little bit on some of the other hormones, but focusing primarily today on cortisol. And then I'm going to talk about what we can do about it and give you a case study recently from my practice. So first of all, the stress response is made up of this HPA axis, and you can see why we call it the HPA axis, because the real name is hypothalamic pituitary adrenal axis. It's a mouthful. But the idea here is it's the feedback loop between the brain and the adrenal glands, which you see sit right on top of our kidneys, which produce both cortisol and DHEA in the outer layer, the cortex, and then also produce the neurotransmitters, epinephrine and norepinephrine, in the medulla, the inside. And this feedback loop is the hypothalamus in the brain sends a message to the pituitary gland, which is just a tiny little thing dangling back there between your eyes, kind of. And that sends this message to the adrenal glands to produce cortisol in response to stress. Now, we're going to be talking about how cortisol can be a problem, but it is a necessary for life hormone in many ways. So what does it do? It mediates the stress response along with the neurotransmitters, epinephrine, which is adrenaline, and it enhances the activity of epinephrine, makes it work better. And it does this via increasing the availability of blood glucose to the brain. It does that through several things. It has end-organ effects, so it increases glucose in the blood by decreasing the storage of glucose via glycogen synthesis in the liver, and increasing gluconeogenesis, which is the production of glucose from in the body. It decreases muscle use of glucose, and it also increases protein degradation to provide those building blocks for gluconeogenesis. It affects the adipose tissues by increasing lipolysis, which releases fatty acids for beta oxidation. And if you're using alternate fuel sources, then you're not using your glucose. And the last thing is in the pancreas, it increases glucagon secretion and decreases insulin. And so insulin, of course, is the hormone that puts glucose into the cells. So if you decrease insulin, then the blood sugar is going to stay in the blood, available for the brain. And I should say, the whole reason it does this is so that you can have that blood sugar to deal with whatever stressor or emergency crisis that you need to deal with. Now, cortisol is released in a predictable pattern throughout the day. It's a diurnal rhythm. And of course, the amount changes based on what's going on with the stress response, but this is the normal everyday pattern. Within 30 minutes of waking up, it spikes in what's called the Cortisol Awakening Response, and that's to get you up and going for the day. And then it goes down gradually throughout the day and then should be low at bedtime. That's important because it needs to be low when melatonin starts going up, so melatonin can do its job. And these two hormones sort of take turns in the 24-hour clock. And so this is just a chart from a laboratory that tests hormone patterns, and it's just showing you kind of the range of what would be normal within that yellow and red line. The cortisol, the HPA axis responds to stress, and I want to talk some more about what stress really is. Dr. Hasid started off today, he referred to this today already as like more than emotional stress, and that's so important, and I really want to talk about that. First of all, stress can be external factors or internal factors. It's also not just emotional, it's mental, it's physical. And the key factors for perceived emotional stress are this idea of novelty of the event. So if it's something new you've never experienced before, that's going to be more stressful. Unpredictable nature of the event. This is like, you don't know from day to day. This is like if you have to walk on eggshells around someone, for example. That's an unpredictable factor that raises your stress. And then, of course, if you perceive it as a threat to your body or your ego, that's a stressor. And then the sense of loss of control has a huge impact on how much you perceive something as stressful. If you feel like you have some say in it and you can manage it, that's different than feeling like it's out of your control. So first, let's break down emotional stress. Relationships, we can all identify with that, I think, like a breakup, for example, or conflict in a relation or with like a parent or a child. Overwhelm, I think a lot of students are familiar with that one. Something that people tend to not think about is lack of positive touch. That's something that our genes really expect us to have. And that's part of the problem with the isolation that James was talking about this morning, is we are not touching each other in a positive way. And of course, you have to be careful how you go about that. And you can't just be touching people randomly. But, with your friends, maybe you don't hug them, but starting to hug your friends can make a big difference in your HPA axis health. Isolation, there's been a lot of reference to that today, and that's a massive stressor. Lack of purpose, that's very important. Lack of safety, that's fundamental. And even our own negative thoughts are a huge stressor. And that's something that I think many people don't realize when they've got this sort of tape going in their mind with old patterns of negative thoughts, that is actually changing your hormones. So physical stressors include an injury, like you sprain your ankle, have surgery, of course that's a stressor. Infection, acute infection, like a pneumonia or something, but this is also low-grade infection. Doctors Long and Chirac are going to talk some more about the microbiome and the gut health, and this is an area where I see a lot of stressors in patients with the dysbiosis going on in their gut, and low-grade like parasite infections, for example. Lack of exercise, we've heard about that today too. That's a very important signal to the body and the HPA axis for health, and not exercising is a problem, but so is overtraining. And overtraining looks very different for different people. We're going to talk about that in a minute. And finally, lack of sleep. That is a massive stressor. I like how in the last lecture he talked about that being a 10x factor. And you'll hear at the end again today that that's the number one recommendation for this, for treating the HPA axis. All right, additional physical stressors, inflammatory foods. There's some foods that create inflammation in everybody. Then food triggers, I separate that because that could be a healthy food that in you in particular, you're having a reaction to. So for you, it's inflammatory, but isn't necessarily across the board inflammatory. Toxin exposure, we're going to hear a lot more about that from Dr. Burke later today. That's a very big stressor. Nutrient deficiency stresses the system. Blood sugar swings, very big, very, very big activator of the HPA axis. So I have hinted at this already, but this idea of how much stress we have in the body, overtraining looks different for different people. I said, well, that's because of this concept of allostatic load. So allostasis is this active maintenance of stability, and the allostatic load is looking at the cost of the cumulative load. So I always try to teach my patients that the body doesn't differentiate between all these forms of stress we're talking about here. It just adds them up. So if you're like having a lot of conflict in your primary relationship and you've got a gut infection and you're training for a marathon, this is going to be overwhelming to the system. The allostatic load is too high. There are times when, there would be better times to train for a marathon, maybe when your gut was healthy and your stress was really well managed and you weren't working 3 jobs and being a full-time student. So it's additive. You have to look at all of it. And so someone who's had a lot of toxin exposure, for example, they're not thinking about that, but their stress level's already very high in their body because of that. And their resilience is then decreased. So what happens when we have excessive stress? We have a high allostatic load. The stress, Dr. Hasid talked about hormetic stressors, when it's past that nice hormetic level and now it's damaging. And the cortisol is going up and staying up all the time. Well, there's different ways it gets dysregulated. One is just that we can have an increase in the cortisol awakening response. So that spike I told you about that happens in the first 30 minutes of awakening, that can be excessive and way too high. And we can also see the cortisol not dropping down during the day, but actually staying elevated. That creates a situation where if it's still high at bedtime, we are tired but wired. That's a problem we see a lot in practice, I think. I just want to point out that this high level of cortisol is different than Cushing's disease, where cortisol is high from a pituitary tumor type thing that's actually causing round-the-clock secretion of high levels of cortisol. And when the cortisol is high for a prolonged period of time, the body starts to try to mitigate the effects of this. One of the things it does is increase the cortisol binding globulin, so there's less free cortisol. And the HPA axis can actually become downregulated. More on that in a minute. Dr. Hasid mentioned this organ reserve and that resilience that has to do with healthy aging and avoiding disease. Well, when we are constantly having to mobilize our nutrients and our resources to manage stress, we deplete the metabolic reserves. We're not able to do the everyday housekeeping in the organs, and that leads to that loss of resilience and to dysfunction and ultimately to chronic disease. Symptoms and diagnoses that are associated with chronically elevated cortisol, either the elevated cortisol awakening response or elevated cortisol throughout the day. I'm not saying here that these are necessarily caused by that. It's both. Some of these are more a result of elevated cortisol, and some of these lead to elevated cortisol. And it's that vicious sort of feed-forward cycle. So I wanted to really talk about the mental health associations. And so both depression and bipolar, insomnia, obsessive-compulsive disorder, panic disorder, PTSD in children. And you can see if you're constantly worried and anxious, you're going to be in that fight or flight state. You're going to be secreting excess cortisol all the time. When we see that extended cortisol elevated, then we see impaired memory. We see a lot of brain fog, impaired cognition. And it's also associated with alcoholism and anorexia nervosa. So when cortisol is high chronically, it has the same impacts as you'd see if someone was taking prednisone for a long time. We have lower bone density. We have abdominal weight gain, impaired thyroid function, insulin resistance, which is, prediabetes, diabetes, poor gut immunity. We know that high cortisol actually decreases our ability to make secretory IgA, which is that first line of defense in the gut against pathogens. High cortisol impacts our sex hormones, and it impairs digestion. It impairs digestion because when we're in that fight or flight state all the time, we cannot actually have proper gut function. You have to be in the parasympathetic state or the rest and digest state to have good gut motility, to produce sufficient hydrochloric acid in the stomach, to release pancreatic digestive enzymes. So the whole system doesn't work when we're constantly in fight or flight with high cortisol. This leads to a snowball effect of decreased nutrient absorption. Then deficiencies in nutrient absorptions in nutrients are associated with numerous mental health diagnoses and chronic health issues. And here's just a list of the basics that we know are associated with mental health problems. Depression in particular, associated with low folate or B12, B6, iron, magnesium, zinc, and the omega-3s. So I mentioned that with chronically high cortisol, we can see HPA axis downregulation. This is the body sort of attempting to protect against this ongoing issue. And this results in the pituitary gland reducing the output of adrenal corticotropin hormone to the adrenal gland. Now, there is a sort of alternative medicine diagnosis you may have heard of called adrenal fatigue. How many people have heard of that term? Yeah, so that is a bit problematic because it's not scientifically accurate. It does describe something we see in practice all the time, but it isn't really the right name. And that's because the adrenal glands don't really fatigue. They're just responding to the signal from the brain to make hormone. What's happening here is the brain is actually changing. The brain is changing its signal. And in fact, all the adrenal adaptogens herbs, they work on the brain. HPA axis dysregulation, we can see a blunted cortisol awakening response. You can imagine if you don't have that nice spike in the morning, it's like hard to get going in the morning, you don't feel good. This is a situation where people feel really burned out and depleted. You can have low cortisol then throughout the day. And I just want to separate it again from the situation of very low cortisol due to Addison's disease, which is actually an autoimmune attack on the adrenal glands. So downregulation of the HPA axis is associated with the whole list of diagnoses, both unipolar and bipolar depression, PTSD in the adult. I think this is because the situation has been so long-standing that it's caused downregulation. Fibromyalgia, chronic fatigue syndrome, burnout, seasonal affective disorder, PMS and premenstrual tension syndrome, rheumatoid arthritis, eczema, asthma, hypothyroidism. Now I want to take a minute and explain this concept of adverse childhood events. And I want to talk about it at this point because I was just showing you how HPA axis downregulation is linked to a whole lot of health problems. And how does that work? Why are they connected? Well, I think talking about this will shed some light on that. How many of you have heard of ACEs, adverse childhood experiences? Okay, that's good. I think the word is getting out about this. We have a new Surgeon General in California who's made this her main focus, trying to prevent ACEs. So this was a landmark study by Dr. Folletti at Kaiser in conjunction with the NIH. He saw this connection between people who'd suffered abuse or had traumatic experiences in childhood or really neglectful experiences and having more diseases really and more mortality. And this study looked at the huge research database of Kaiser and found they defined adverse childhood experiences originally as any kind of abuse. Violence against the mother was how it was originally defined. Living with household members who were mentally ill, suicidal, substance abusers, or had ever been incarcerated. And this was their conclusion. There was a strong connection between how many of those you had experienced, so your ACE score, and multiple risk factors for several of leading causes of death in adults. And originally this focused more on, okay, this led to behaviors that cause health problems like smoking or low socioeconomic status and things like that. But it turns out to be more than that. So there have been additional studies since then, and they've broadened the definition some. So it's not just violence against the mother, but it's domestic violence. It doesn't matter which sex. Parental separation or divorce, bullying, discrimination, and witnessing neighborhood violence. And what we found is there's a significantly higher rate of chronic disease, so autoimmunity, cancer, heart disease, diabetes, and mental illness. How does this happen? Well, it's fascinating, but ACEs alter brain development. So the prefrontal cortex is affected, and that's in charge of executive function, attention, and self-regulation. The limbic system, here I put a few things in bold here because they relate the most to what we're talking about, which is emotional regulation. That's the amygdala and the hippocampus, our mammalian brain that's processing sensory input and deciding what is a threat. It results in reduced brain volume. It changes our immune system. It increases inflammation, and interleukin-6 and C-reactive protein are markers of inflammation that have been seen elevated in ACEs. And there are epigenetic changes, so it actually changes our DNA. It does that through DNA methylation and shortened telomeres, which Dr. Hasidah talked about this morning. Finally, it alters our HPA axis. It results in fewer cortisol receptors and downregulation of feedback. And it's through these mechanisms, especially I think the immune system changes and the HPA axis alteration in the limbic system dysfunction, that it actually changes our susceptibility to things like autoimmune disease. Now I want to shift and talk about the effect of cortisol on other hormones and the effect of other hormones on mental health in our last bit of time here. I mentioned earlier hypoglycemia, or blood sugar swings, are a very profound trigger for the HPA axis. So when you're eating the standard American diet, you have a lot of carbohydrates, there's going to be blood sugar swings. You're going to have a big spike in blood sugar, and then the insulin's going to be secreted, and your blood sugar is going to drop. How many of you heard of that term, hangry? You're hungry and angry. There's a lot of that going on. And that is partly, when that's happening, you're triggering the release of cortisol. Why? Remember, it's a glucocorticoid. It's mobilizing glucose. It's like, whoa, the blood sugar's really low. We need to get it going to save the brain. So that's constantly triggering the HPA axis. And in the process, people experience anxiety triggers. Adrenaline is often also released, which really gets anxiety going. And insomnia, if your blood sugar is crashing in the middle of the night, that's a lot of times a cause for waking up. Now, chronically high stress then leads to insulin resistance because, remember, the glucocorticoid, cortisol, is causing blood sugar to be up. And if it's up all the time, you're going to lead to insulin resistance. This is associated with depression and bipolar. I remember in residency really learning uncontrolled diabetes often is associated with depression. And this is why. Elevated insulin also leads to inflammation, which will then be a feed-forward cycle for more depression and other mental health issues. Now, a word about thyroid. So cortisol, when it's elevated, will actually decrease thyroid-stimulating hormone and have the impact of you producing less thyroid hormone. It also decreases the conversion of T4 to the active T3 hormone. So that's one of the ways that it can be linked to depression, is it's lowering your thyroid hormone that you need for feeling good and for metabolism. Now, thyroid hormone can be lowered because of other factors like nutritional deficiencies in, say, iron or iodine or selenium. And when you cannot produce enough thyroid hormone, the brain tries to get the thyroid gland to make more and will increase the thyroid stimulating hormone. And we know when the TSH, the thyroid stimulating hormone, is even over 2.5, which is not the value on your labs usually that they would call high, that subclinical hypothyroidism is strongly associated with depression. The only practitioners besides functional medicine doctors who use a tighter range on thyroid hormone is OBGYNs, because they know it impacts pregnancy outcomes. But normally if if your thyroid stimulating hormone is below 4.5, they're going to say, oh, it's normal, no problem. But we know it is not normal. So sex hormones, I'm really not going to do them justice today because they're very complicated, but I want to just point out they are very impactful. And we know that progesterone, estrogen, and testosterone need to be in balance in both men and women to have the right to feel good and to function well. And they're also very, very important for brain health. I can't really overstate that. So good cognition depends on that. So we know cortisol can impair or block the pre-ovulatory release of LH, FSH, and the estradiol surges that are supposed to happen with ovulation. They also, we know that chronically high cortisol will impair testosterone in men. Low testosterone in men is associated with depression. And we know that low progesterone in the luteal phase, that's the second half of the menstrual cycle, is associated with PMS and symptoms of depression and anxiety. And finally, I just wanted to say that estrogen especially is neuroprotective. In the wonderful work being done by functional medicine physicians with Alzheimer's, estrogen is a key player, very, very important. Just an interesting note that when women have a total hysterectomy, they are 10 times the risk of Alzheimer's later on because of the sudden drop in their estrogen. It's very, very important. There's really, these sex hormones have a huge impact on mental health. What we see, I think, all the time in practice is how much it has an impact, and especially when they're out of balance, like when estrogen is high and progesterone is low. What can we do to regulate our HPA axis? You see how it's impacting all levels of our health, physical and mental health. And how do we have a healthy HPA axis? Well, I put this just in huge letters here because this is the most important thing. We really, really need to manage sleep and circadian rhythm. Sleep is the very first thing that we need to be addressing when we talk about having healthy hormones and healthy stress response. We need 7 to 8 hours nightly, and this is important. It's best between the hours of 9 p.m. and 8 a.m. You'll see why in a second here. So light exposure has a huge impact on the HPA axis. It turns out that there are like local HPA axes in the skin. It's very cool. So light exposure on our skin is not only important for vitamin D production, it actually triggers the release in the skin of cytokines and actually corticotropin-releasing hormone. And these enter the bloodstream and then have systemic effects, and they will activate the central HPA axis in the brain. And we also see similar effects after exposure to the retinas with light. And so this is a trigger for the HPA axis to have its normal circadian rhythm. So managing our light exposure is really, really important. I talk about this with my patients all the time because I think our society at this point really disrupts this a lot. And if you're having trouble with sleep quality and sleep quantity and mood issues or health issues, it's just fundamental. So it begins with light exposure in the morning and getting outside and getting light on our skin, in our eyes, and especially upon awakening. The other flip side of this, and this is the part that I think is most of a problem for people, is light exposure in the evening. And I think students studying at night can understand that this is, you're seeing a lot of screens, right? And most of us, we're spending time on our phones, we're watching our big like LED TV screens, and we're looking at computers or tablets. Well, they emit a certain wavelength of blue light that is the exact wrong kind to tell us it's bedtime. That light is telling your body it's morning. And this decreases the melatonin production. It affects your sleep architecture, so actually how much time you're in the different stages of sleep and the continuity of your sleep. And studies show it impairs your morning attention. So one of the things that's really important is to minimize your screen time the 2 hours before you go to bed. And I recognize this isn't always possible, but just being aware of it and trying to shift some of your activities can make a huge difference. You can wear blue blocking glasses, both when you're using screens and even just around the home before bed to reduce the light exposure, and it can really help aid in your sleep quality. And then there's some apps for computers that can help with shifting the light. So for example, on an iPhone, night shift is in your settings. You can set that. Mine is always set to go at 7 p.m. I try not to look at my phone at all in the evening, but if I have to, it's going to be more amber light, and that's very, very helpful. And Flux is one you can get on your computer. So additional treatment for HPA axis, of course, is reducing stress. So we talked about adverse childhood experiences, so treating trauma is very, very important. There's a number of effective therapies for trauma, but I've listed here EMDR, trauma-informed yoga, or other somatic therapies are really helpful, but that needs to be addressed. Someone who's traumatized and that's not processed is going to be constantly in fight or flight and have elevated cortisol, or have had it so long that they will have HPA axis downregulation. You need evaluating your life, looking at, do you need to make a hard decision about something? Do you need to change jobs? Do you need to end a relationship? Maybe you have a toxic friendship that's not serving you. Do you need to increase your community, find purpose, or change your thoughts? There's a lot we're doing internally that is promoting stress. What can you say no to? And then exercising at an appropriate intensity, duration, and frequency given your total allostatic load. So looking at the sum total of stressors in your life and saying, well, what's the right amount for me right now? An anti-inflammatory, nutrient-dense diet is a wonderful way to reduce stress on your body. This means whole foods, lots of vegetables every day, and you need those veggies for the fiber and the phytonutrient. The fiber is key for your microbiome health. You'll hear more about that, I think, next. And you want to focus on eating the rainbow, getting a wide variety of colors in your diet, not through Skittles, but through vegetables, because that's going to be a wide variety of phytonutrients. You want to include good fats, and avoid highly processed oils. You want to choose really healthy fats like avocado oil, ghee, coconut oil for high heat cooking. You use extra virgin olive oil in cold applications because it can be damaged by high heat. And you want to make sure you're getting adequate protein and clean sources of protein. And really key is avoiding the refined carbohydrates and sugars. I can't stress that enough. That's the biggest thing. That's causing those blood sugar swings. It's causing lots of inflammation. And it's depleting nutrients. You want to maintain healthy blood sugar through low glycemic diet. So reducing stress is one thing, and then there's the stress we cannot avoid. We're not looking for a life with no stress. We know we talked about hormetic stress, and that stress has a role. We just want to have healthy levels, and we want to know how to manage it when it comes along. And these are some tools that can make a big difference in our resilience around stress. So tools like meditation, there's so much research now to support how beneficial that is. Yoga, just general movement, like walking regularly, will reduce stress and help you feel more resilient. Mindfulness, journaling, the naming of emotions is very helpful for processing them and reducing stress around them. Practicing gratitude, lots of great studies on that. And time in nature. That's another one of those things like light that our brains are really evolutionarily expecting, and we often deprive ourselves of nature. Getting enough laughter, having fun and playing. That's not just for kids. And then what else can we do? Well, sometimes we need to work with a practitioner to actually evaluate and test hormones and treat imbalances. We need to identify those other underlying triggers and stressors you may not know you have, like gut dysbiosis, infections, toxin exposures that need some additional assistance. I mentioned Dr. Burke's going to be talking about toxins in depth later. That's a one where a practitioner in particular can help you. Stabilizing blood sugar and balancing the microbiome and supporting the HPA axis with appropriate adaptogens. And what's neat is there are many, many of these impacts on the HPA axis that are stress-induced that can be rapidly treated. Now, some of the longer-term stressors like trauma, adverse childhood experiences, they may require long-term support, but it's important to know that it's not your destiny to have these diseases if you had adverse childhood experiences. I mean, that can be sort of the depressing take-home when you read those studies, but it's important to know we can really modify the brain. We can change the way our HPA axis works. We can heal a lot of that, but we don't do that overnight either. So just important to know that you can really do a lot, but you may need to do it for a longer period of time. Like we don't exercise once and then say we exercised, we're done for life. It's the same with things like meditation or other practices. We need to make them habits and long-term practices. I just put this slide in here because early on in my functional medicine training, it was sort of described to me as stress is the elephant in the room. And I think this is really true. People who are really health focused are often really into their diet and maybe really specific about their exercise, and maybe they're wearing their amber glasses and they're biohacking and doing all these things. But this is the thing that people usually don't want to deal with. And it's really so key. It's just, I cannot overstate how important it is. And I just want to encourage you, to remember that's the conversation to have with your, for those of you who are going to be working with patients or clients in the future, you just want to be having those conversations because not enough people are asking them about that and helping them with that. And I'm going to close here with this case study of a patient of mine, a current patient who's working with me in my program, in my practice. And she's a 36-year-old with chronic, severe treatment-resistant depression. She's had depression for at least a decade, and in the last 5 years, very severely, to the point that she's actually had 2 past suicide attempts, and she has chronic suicidal thoughts. Her depression has been unresponsive to medication, to therapy. She's even had TMS, which is transmagnetic stimulation, and she even had ECT last summer, which is electroconvulsive therapy, and no improvement on these. She only has a couple days out of the month, or at this time she only had a couple days out of the month where she didn't feel suicidal, and those couple days of the month were during her period. She was working nights, and she had a history of a prior abusive relationship. She used to really enjoy her job, but things had changed at the job, and now she felt like she wasn't really of value there, and she was lacking a sense of purpose. She had, through her depression, really isolated herself from her friends. I don't think working nights helped that either. And she, like so many of my patients, will be like, oh, I eat really healthy. And then when you really ask, it's like, well, not really. They're following old conventional advice, like we should be low fat, and they're having too many refined carbs and not enough fiber and veggies. So with testing and on her history, the findings included that she did have a dysregulated cortisol pattern because she'd been doing that shift work and from her chronic depression and her inflammation. She was making antibodies to her thyroid glands. She had Hashimoto's thyroiditis, so her thyroid was under attack and the thyroid hormone levels were imbalanced. She also had very low progesterone and extremely high estrogen. And this is not a shock when we hear that the only 2 days of the month that she felt good were in the middle of her period. She had gut dysbiosis on her stool testing results, and she had elevated beta-glucuronidase. That's something produced by gut bacteria that will impair the excretion of estrogen. So this was one of the reasons that her estrogen was very high. She also had exposures to xenoestrogens, which again you'll hear more about later, but those are things from plastics and cosmetics and lotions and stuff that so many women are exposing themselves to. And finally, she had a genetic mutation that meant it was hard for her to make active folate, and she had low vitamin B12, and as a result of those factors, she had elevated homocysteine, which is a marker of inflammation. So the treatment plan we came up with, she went on short-term disability. That's not a normal part of my treatment plans, but she had already been on disability during the ECT, and she really was a very extreme case of depression. She was like, if this doesn't work, this is my last hope. Which you don't want to hear when someone comes to you, but luckily I felt like I think I can help her. And she, right away was like, you can't be working nights if we're going to heal you right now. This is not going to work. Put her on an autoimmune paleo diet to identify and remove food triggers. This was important as we had found that she had autoimmunity in the form of Hashimoto's. There was nutrient support for missing nutrients like magnesium, omega-3s, B vitamins, and more. She had gut dysbiosis that, as I mentioned, so we treated that and we used a gut healing protocol. We supported her progesterone and supported estrogen metabolism and excretion by binding the beta-glucuronidase and, of course, getting to the root cause, which was the gut dysbiosis, and supported methylation. And this is, this is not last and least. This is key, which is learning the stress reduction techniques, learning to retrain some of those negative thoughts. She'd been depressed so long that her brain was really in a rut around certain thoughts that needed to be addressed. And she journaled regularly, and this was the beginning of changing her brain patterns. So within 2 months, she had dramatic results. And the first time in 5 years, she was free of her suicidal thoughts. It was really profound. She was able to participate in activities with friends. She went on an overnight field trip with her child's class, which was something she'd never, ever would have done before. Her relationships had improved, and she was starting to have interest in looking for a job that was going to be a daytime job, give her new purpose, and support her health in the timing of the job. So that brings me to the end of my talk. This is just my practice information, and I added here there's some stuff on my website for anyone who wants some free guides and information. And thank you so much. It's been a pleasure.